Check it out. KFRU.com is where you can find the podcast tab. Also at KLIK1240.com. And they'll have that, and that'll just drop down, and you can check it out. And you can also check out the previous Missouri Orthopedic Institute segments that we've done. We've done them every Thursday. The first couple weeks were Dr. Sherman, and last week was Dr. Aaron Gray talking concussions. So we've done hydration, we've done heat stroke, heat illness, concussions, general bumps and bruises. And keep in mind that the orthopedic clinic, Missouri Orthopedic Clinic, is open on Saturday mornings, 9 a.m. to 10 a.m. It is the free walk-in clinic. For those of you who played football the night before, high schoolers and middle schoolers, that is available to you for the assessment, free of charge, and if a referral is needed, they will provide that. Joining us this week is Dr. Richard Ma. He is an orthopedic surgeon, an assistant professor of orthopedic surgery as well, sports medicine. Happy to have you alongside. Thank you very much for taking the time out to join us today.
Thank you guys very much for allowing me to join you guys this afternoon. Yeah,
well, you've been hanging out for a little while, so you've kind of gotten used to the little nuttiness of this particular program.
That's awesome.
Yeah. Well, thanks. Appreciate that. When Eric and I were going back and forth on what to talk about this time around, the fact that you were a joint specialist led me immediately to two things that we hear an awful lot of on injury reports for football, and that is labrum tears and or repairs and ACL issues. So let's start with the shoulder and work our way down. The labrum, most people think dislocated shoulder. You pop that right back in. The normal person, they're in a sling for 4 to 6 weeks, and then range of motion and go forward. Why is it so different from the normal person as opposed to a football player who it seems like they always have something going on with a labrum?
Well, I think one part of it is just the nature of the sport that they're in. It's a collision sport. It's a violent sport. And we know just based on incidents of shoulder dislocations that tend to happen when you're a lot younger, and activity and predisposing risk factors matter. And so for those individuals that dislocate their shoulder, yes, it could be reduced, but the other thing that should be talked about is also the chance of them redislocating.
Okay.
And so for a lot of these kids that dislocate in the season, we could get them back potentially to play within the same season. The question is, are they going to dislocate again? Mm-hmm. So for them, it has a higher relevance because of the age and the risk factors that they have if we get them back to playing.
And we've also heard the grade 1, grade 2, grade 3. So walk folks through if the diagnosis comes back on the different grades. What does that mean for the patient?
Well, I think for me, I try to keep it more simple.
Okay.
I think it's either they had a subluxation event where it didn't come fully out, or they had a complete dislocation where it's come completely out, and they've had to have it reduced. The other thing that's really important is this their first time, or have they had multiple episodes? And the big predicting factor is what they're going to go back to do and how young they are, mm-hmm. because everybody's trying to figure out, is this something that we could treat without surgery or we can treat with surgery? And so all those things taken consideration allows us to come up with a treatment plan that's right for that individual.
When you look at some of the numbers, I don't know, how much return information you get. How much more likely is someone who, especially if it's fully out, if you've had kind of the worst dislocation, how much more likely is an athlete to have another event if they get hit again?
Yeah, so some of our best data on this to guide people come from the military population, especially the individuals in West Point, and those are young guys. They're very active. Sometimes getting back into situations that are high risk. If you look at individuals in that population, 90%, greater than 90% chance that they're going to dislocate again after a primary dislocation and after it's reduced. And there's not a lot of things in medicine that's 100%. But right. 90 is pretty close.
Yeah, exactly. My father was steel pins in his shoulders and still had dislocations and all kinds of problems his whole life. I helped him numerous times with the here, lean up against me so I can do this. And as a non-trained medical professional, not the best situation to be in. But I can only imagine, when you get a kid on a Friday night, especially, or again, anything. An outside hitter in volleyball, anything where that could possibly occur, and how scary that feeling is, and to try and treat it, and then not knowing what your options are moving forward to continue on in that sport, that season, and everything else. How do you guys help address that when they're getting checked out for the physical damage to go along with how they're processing their future in that sport?
Yeah, I think, obviously the scenario just kind of depends on where you are talking to the athlete. You approach it very different when you're on the sidelines. If you just diagnose that injury and help put that shoulder back in versus in the clinic setting. I think for me, when I counsel these kids, I try to understand what their goals are.
Okay.
You have to, and this typically involves families, especially some of these younger kids. And I try to get them to see it step by step instead of the whole picture. Usually if you do that, and you involve them in the decision-making process and make them understand what the issues at hand, some of these kids are pretty resilient. You'd be surprised in terms of their mental resiliency and ability to focus in those type of situations.
Dr. Richard Ma with us here on the Closers, Missouri Orthopedic Institute. Again, they're a free clinic on Saturday mornings from 9 to 10 a.m. It is a walk-in clinic for the high schoolers and the middle schoolers. And if referrals are needed, they can do that, but they can also handle x-rays right there on site and at least get the initial diagnosis going. For you working on a sideline or in the clinic setting, what's the diagnosis process on the shoulder with the potential labrum issue?
Yeah, I think everything begins with a physical exam.
Okay.
I think a lot of times just hearing which position the shoulder was in when it happened, a lot of times you can diagnose which way it may have came out, and usually if it's a full dislocation, that's a pretty clear description. Then it typically involves an x-ray. We want to make sure that the shoulder is indeed completely reduced, and then we want to just try to get an idea, was there more than that? Were there any bony injuries in addition to the shoulder dislocation? And then typically for me, we move on to more advanced imaging. That typically involves the MRI. And depending on the acuity of the injury, sometimes we may even do a special MRI where we put a little dye into the shoulder joint just to try to get extra detail and get an idea of what the injury and the severity of the injury is. And then after you have that information, we can then talk about how we should move forward in terms of the treatment plan and the treatment process.
When do you hit that break point? Treatment, rehab, surgery, rehab.
I think usually after the MRI, and after kind of getting an idea, where the kid is in terms of the season, and what that season means to that kid, whether or not how many dislocations they've had, we can usually then make a decision: do we treat this without surgery, or we treat this with surgery? Once we have all that information, we usually make that decision in conjunction with the family and talking with the athlete. Okay.
Non-surgical, the rehab, is it what the exercises to strengthen the muscle group around there to hold that shoulder back in place?
Yeah, so typically no surgery for me. Usually maybe a week or so of sling immobilization, and then get them in formal physical therapy to re-engage the muscles around the shoulder to help stabilize the shoulder joint. Those muscles are important. There's no other joint in your body where you can rotate it 360 degrees around. And so the muscle has a big part to the stability of the shoulder joint. Typically getting them back to play, they will have to demonstrate full range of motion, no pain, and basically ability to protect themselves, especially if it's football. It's a collision sport. They got to be able to demonstrate adequate strength to protect that shoulder. And sometimes people use a brace. Certain positions may be amenable to playing with a brace to kind of prevent getting the shoulder into a certain spot to prevent them from coming back out.
And then if the surgical option is there a point where you, as you're looking at that MRI going, there's the only way to stabilize this is the surgical option?
Yeah, I think there's certain features. If it's one of those situations where this shoulder's coming out multiple times and now you're seeing bony erosions on the socket or a large bone defect on the humeral head, there's a certain appearance to it that's going to make you look at this and just think that it's not going to take much for this thing to come back out again. In which case, you have to discuss that with the kid and make them understand that and help guide them to hopefully making the right decision here.
We're going to move down to the ACL here in just a second, but for those who have gone through surgery, we've seen this with the Missouri Tigers. You follow it with the Kansas City Chiefs. Anybody that's played football, you kind of follow that. What's atypical for a healthy, except for the shoulder issue, athlete, what's the expected recovery time where they can get back to regular activity?
Well, I think if you're talking about full participation with sports with an isolated ACL injury, typical time frame is somewhere between 6 to 9 months, for me. But I think a lot of us are moving away based on just time frame. A lot of us are also looking at functions now. Okay. Doing some sort of functional test to make sure that that kid has enough ability to protect themselves from having another injury, because recurrence, is common. And one of the ways
we're talking the shoulder now.
In terms of a shoulder.
Yeah, we'll get to the ACL in just a second, but that shoulder issue. So
for me, in terms of shoulder stabilization surgery, typically 4 to 5 months, for me.
Okay. All right, Dr. Richard Ma with us here on the Closers. We're going to move from the shoulder. Again, they've got the free clinic is Saturday mornings from 9 to 10 a.m. It's just you just walk in. They'll do the initial assessment. They do have the X-ray facility available as well, but it's a great place to get started for the MOI, and then they'll refer you later. ACLs are something that we see and it's across sports now. It doesn't seem to be all that specific as to a sport, but for you, on an ACL, what is the one that it just makes you go, ugh? Is it the non-contact or the contact ACL issue?
I don't typically think of non-contact versus contact as the deciding factor in terms of how severe the injury is. I think an isolated ACL injury is an isolated ACL injury. I think what makes me may think this is a more severe injury is if they have an ACL injury plus, like a meniscus injury or a cartilage injury. I think that has a more prognostic factor more than just the contact mechanism.
There's been so many knee injuries. I mean, high-profile athletes all the way down through. You see kids in their Letterman's jacket on high school campuses with their crutches, and the knee is all wrapped up. At this point, is the diagnosis at the time of the injury, Friday night, Saturday at a tournament, if it's basketball or volleyball or baseball, is the diagnosis on the field at the time to the point where a competent athletic trainer is going to know, okay, right away, kind of what we're dealing with and kind of, how to handle that? Or is there still some uncertainty, at the point of the injury?
I think for complete tears, usually in a competent hand, just based on exam and the laxity of the knee, I think you could probably have a pretty high suspicion. And then the MRI is mainly confirmatory at that point.
And usually the athlete will tell you, I heard a pop.
Yes. So sometimes they, the mechanism, non-contact, the pop, the amount of swelling that you may see, they all raises the level of suspicion. And then the clinical exam by an experienced hand, I think a lot of time is pretty dead on.
We've seen a lot, and this is where the experience factor comes in, that as time has gone on, the surgical procedure has improved. The amount of recovery time has decreased. For you as a surgeon, when you get in there, especially on a young kid, whether it's a male or a female, we've seen it in basketball. I mean, Jordan Frericks had it a couple of years ago for basketball. Is it possible for you to kind of judge how quickly they can return based on the shape of the athlete that has been in and the type of sport, whether it's basketball or football or baseball or tennis?
I think there are some things about the kid that sometimes may think that they can accelerate the rehabilitation. I mean, I think certainly if somebody that physically is pretty well trained, and they've demonstrated that because they're a higher level athlete, and if they're in a high level competition where they're surrounded by great trainers, that kid can probably move through the rehabilitation pretty easy versus somebody that's a lot younger, may not be as skilled and less trained. Those type of individuals may move through the rehab at the end product just fine, but may take a longer process to kind of get to that point.
I know we've talked ACLs and we've talked to the labrum. And again, folks, there's a free clinic on Saturday mornings from 9 to 10 a.m. over at the Missouri Orthopedic Institute. It is a walk-in clinic, and they provide referrals, initial diagnosis, and also X-rays. There has been a lot of talk, as we wrap this up with this particular topic, of sport specialization. You see it, whether it is baseball, football, soccer, where it has become a 12-month-a-year process. How hard do you have to work with the parents to go, no, your kid needs to diversify? This is like your portfolio. You need to be diversified early on before you zero in.
I think that's a really challenging conversation to have with with parents because I think every parent, as they should be, they're really proud of their kids. They're hoping that they're going to develop into somebody that's going to be really high caliber and be able to excel in that sport. It is tough because I think they want to support their kids. The kids hopefully are enjoying the sport, and so breaking that cycle, especially when it's an injured athlete. That's hard because that has an effect on the kid, not being able to go through their normal routine. They're afraid away from their friends. So there's multiple factors there that makes it challenging to have that discussion and asking them to take time off when they've enjoyed that sport.
And is it? And I was telling you off air when I was growing up and I was playing sports. I swam during the off season, played baseball in the fall, and then swam in the wintertime, and then baseball back again in the spring and the summer. Is it different sports that utilize different muscle groups? How do you work with a parent and or a coaching group to make sure that the athlete isn't getting that repetitive motion injury?
Yeah, I think, certainly over-specialization, meaning just playing one sport more than 8 months out of the year, may force a kid not to be able to develop as wide of a neuromuscular training regimen as, say, somebody that played multiple sports. But I think the other thing that I don't want to get just attached to single sport athletes is also the volume. You can certainly also wear yourself out if you play all year round, but you play all different sports. There's actually quite a bit of research out there that shows that for kids, especially developing kids, if they play sports more than 8 months out of the year, even though if they're a multi-sport kid, they are also at risk developing overuse injuries. So it's not necessarily just focused on one sport. It's also just getting opportunities to let the body rest and do something different so that they can grow. So I think even if you play multiple sports, but you're playing all year round, you still may be at risk to develop injury versus a kid that may have a more rounded approach and at least have a part of the year where they make it a break from organized competitive training.
And Dr. Richard Ma, okay, as we get ready to wrap this up, what's your favorite sport to watch?
Oh man,
you're not. I mean, you're not have to worry about running down the stands and covering an injury. You're just sitting there and just watching it.
Basketball by far. Big basketball fan. Covered the sidelines for the New York Knicks when I was out in New York, and I had a great time. So, love basketball all levels. So
you're a Knicks fan, and you still love basketball.
Well, I'm not really a Knicks fan. I was a Knicks fan for that year.
Okay.
But I don't know. I've been in purgatory the last couple of years because I'm actually a Lakers fan. Although things may turn around.
They signed a big. They got some guy. Some swinger named James, right?
Lil Dang.
Yeah.
Oh wait, no, they just got rid of him.
LeVar Ball. That was Lonzo Ball. No, one of the Ball boys. Yeah. So you should have some excitement now with the purple and gold.
A little bit.
Okay.
So we'll see how it goes.
Okay.
Yeah.
Favorite sport to be a sideline physician for?
That's really hard for me.
I'm asking you to pick one of your favorite kids, right?
Yeah, I mean,
okay.
absolutely. So I think I've actually enjoyed being on the sideline for a variety of sports because I've had a chance to cover quite a bit. But I do have to say football is a lot of fun. I think the passion that you see from kids, the contact, the adrenaline is great.
Yeah.
It most makes me feel like I'm back in my high school days.
What sport did you play in high school?
I played football and soccer when I was in high school.
All right. Dr. Richard Ma, you can he's part of the Missouri Orthopedic Institute, sports medicine surgeon, and also an assistant professor of orthopedic surgeon. Doc, I appreciate you taking the time.
Yeah,
I really do.
Yeah, I really appreciate you guys allowing me to be here.
Yeah, not a problem at all, man. It was either that or we get to talk ACLs and labrums, and you don't want that to happen. I don't care how many Holiday Inn Expresses we've stayed at. So, Doctor, I appreciate the time, man. Thank you.
Thank you.
You are very welcome. That is Dr. Richard Ma, orthopedic professor over at the University of Missouri and also sports medicine physician. Don't forget, Saturday morning, 9 a.m. to 10 a.m. is the walk-in clinic from Missouri Orthopedic Institute. Check it out. Referrals, initial assessments, and also they will do x-rays.
The Closers on News Talk 1240 KLIK and News Talk 1400 KFRU.